Looking at Chapter 55, Periodontics, but before we get started, let's think back to DEA 121, Dental Science 1, where we talked a lot about medical terminology and what the suffix was, the prefix, the word root, looking at these terms and what their definitions were. So in order to identify what specialty we're talking about, let's go ahead and break down this word. So if we look at our prefix, peri, and if you remember back, peri means around or surrounding. We have our word root, odont, which refers to tooth. And then we have our suffix ix, which is referring to either knowledge, practice, or treatment. So if we put this all together, what we have is the treatment of the tissue surrounding the tooth, or the area surrounding the tooth. And when we think about that, there's a couple things that should come to mind. First one being the gingiva, or the gum tissue, and the second being the alveolar bone. If you remember, our teeth sit into the socket and are surrounded by the gum tissue, or the gingiva. And I'm hoping that you're starting to see that we actually do use medical terminology a lot when it comes to dentistry, and why it's important for you to have an understanding of it. So a little bit of a review here. We have the gingiva, and for some of you who just finished with 121 last semester, this should look very familiar to you. And for those that maybe it's been a semester or longer, hopefully you still remember it. But in order to have a good understanding of periodontics, especially if you're possibly wanting to pursue a career as a periodontal assistant, and definitely if you're going on to pursue a career as a dental hygienist, you have to be very knowledgeable when it comes to the gum tissue and understanding the various types and what their purpose and function is. So to get into a little bit of a review here, we know that we have a couple of different types of tissue. We have our attached gingiva, which is going to look lighter in color. It's going to be more of the pinkish salmon color compared to the dark red that would be in our vestibule area. And it does basically what the name says. It is firmly attached to the alveolar bone. And its purpose is to protect and prevent any kind of debris or food from getting up underneath the gum tissue and coming in between the bone and the gums, basically. So it protects the teeth. We also have our marginal gingiva, which is depicted here by this dotted line, and it's also known as free gingiva. And you can actually kind of displace it a little bit. So it's not attached, but what it does is it surrounds the tooth. So if we think about a collar on a shirt, the collar on our shirt surrounds our neck, and the marginal or free gingiva does the same thing. It surrounds basically the neck of each of our teeth. We also have our interdental gingiva, which would be located in between each of our teeth, and it sort of creates that sulcus, that V-shaped embrasure that we're able to identify and see, and that's going to be normal to have kind of that V-shaped in between each teeth, so that when we floss, you know that when we stick the floss in between, we're actually able to get a little bit underneath that interdental gingiva because it's part of that free or marginal gingiva that is not attached to the bone, and we're able to remove any debris that might be in there. We also have this gingival groove here, which is sort of this area right here. You could probably see it a little bit better on this area. And what it does is it's where the attached gingiva meets with the marginal or free gingiva, and it sort of creates that connection. So you're going to see it. It's very subtle. It's a slight depression that you're able to see where the two come together and meet. Very similar to our CEJ on our teeth, where our cementum meets our enamel, and it sort of creates that junction or that groove. This is the same thing. Attached meets the free or marginal gingiva. So what perio is not? You're going to be learning a lot about what perio is, and it's important that you have a very good understanding of what it is not. This is not perio. This is what we wished all of our patients looked like when they walked in the door. You can clearly see that this person's gum tissue is very pink. It's very healthy. It's not irritated. It's not red. It's not swollen. This is a healthy mouth. You can also see in this panoramic x-ray down below, which is why it's important that we take x-rays, because we need to be able to identify, we can also see there's wisdom teeth here that we may not be able to see if we were to take just a regular PA. We can also see that there are no wisdom teeth here on the upper. But we can also check bone levels when it comes to x-rays. That's something we can't determine just by looking at the mouth. So we can clearly see in this one that the bone level on this patient is where it needs to be. This is a person who has a healthy mouth, who has very good oral hygiene practices at home. They're probably, regular patients when it comes to coming in every 6 months to get their teeth cleaned. So this is what perio is not. Next is the periodontal exam. This is usually done in conjunction with the new patient exam. As we're seeing a brand new patient for the first time, we're going over and identifying any pathologies that are in the mouth, what's existing, what's possibly needs to be done, and also doing a perio exam as well. This can be done either with or as a separate appointment, either with the dentist or the dental hygienist when it comes to the perio exam. Sometimes the perio exam and the initial appointment or the initial new patient exam might not be as in great detail as it might be the next time they come in and we look at their overall perio health. But some of it might be done just to identify maybe what type of cleaning that patient's going to need. So what is included in the perio exam? Well, we still are, just like with everything, we are needing to take vitals. We need to look over the patient's medical history. We need to identify if there's any changes to their medical history and make any updates that we need to, if there's any changes to their medications. And we're also documenting all of that information. Your role as the perio assistant, if you're working for a periodontist or even with a hygienist, is you're recording and documenting all of this information. So it's very important that you know what you're doing, that you pay attention, and if you are unsure that you're asking questions, because we refer back to these previous exams all of the time, and we want to make sure that this information that we are recording is accurate. So first thing the dentist or the dental hygienist is going to do is they're going to check for mobility. So usually done between two instruments, and they're going to see if there's any movement to the teeth. You do have to understand that our teeth move slightly. That is natural. We know that what surrounds the roots of our teeth in the socket is the periodontal ligament. And you know that that periodontal ligament acts somewhat as a cushion or a shock absorber. So as we chew, there is going to be some slight movement within our teeth. What's not good is if we can really see that movement going on. That is not good. So they're going to check for mobility to understand the health of the patient's perio condition. And there's going to be different types of levels. And this is, again, something that you're going to be recording on your perio exam. And each of your dental softwares, doesn't matter what you're using, each of them have a specific perio exam that you're going to be going to be able to record all of this information as it's being identified and called out to you. So you need to know the different levels and what they mean. A level 0 means that that is normal. And again, there's going to be maybe some very slight movement, which is normal. So that would be considered 0. 1 is going to be considered slight. It's going to be considered slight mobility. And then your 2 is going to be considered moderate mobility. And then anything over a 3, that means it's really moving, it's really rocking there in the socket, is going to be considered extreme or severe. So that can be documented based on, here looking at your perio chart here, this happens to be Eagle Soft. We actually have a category here for mobility, and we're able to identify 0, 1, 2, 3 based on what it is. And what it does when you're recording it is you see all of these abbreviations here, and mobility is right up here at the top, and you can see that on some of these teeth, they've recorded mobility. These tooth number 4 and 5 have a mobility of 3. Tooth number 12 has a mobility of 3. Tooth number 13 has a mobility of 2. A lot of times, if it's a 0 or a 1, they may not choose to record it. But definitely if it's anything above a 2 or more, they're definitely going to want to record and make note of. And it's also going to depend on the dentist and the dental hygienist as well as to whether or not what levels they're wanting to actually record. So mobility is going to be one part of the test. We also have looking at the tissue. So they're going to be looking at the color, the shape, the size, the texture, just to make sure that the tissue is healthy, it's not irritated, it's not red. So they're going to kind of do a visual exam to ensure that the tissue itself is looking healthy and pinkish. And one thing I do want to point out is you have to remember, and we've talked about this in 121 as well, that it's going to depend on the ethnicity of your patient. If your patient is of Hispanic or African American ethnicity, remember their gum tissue is going to be darker, which is natural. And being able to determine what's going to be normal and what's abnormal based on your patient's ethnicity is going to be extremely important. So looking at the tissue is another part of that. They're also going to be probing for pocket depths. And pocket depth is determining the amount of epithelial tissue attachment that is present. Again, there's going to be different levels to that, starting with 1 and working your way up. 1 being normal, 2 being normal, 3 is still considered normal. There could be, starting at 3, could be the beginning of possibly some bone loss starting to occur. But anything from a 3 and below is usually considered normal. Anything above a 3 is considered to be the stages of bone loss and the severity of bone loss. So obviously the higher the number, the more bone loss that there is. And that can be due to a number of things. Bone loss can be attributed to shifting of the teeth. Maybe teeth have been lost, either due to having to be removed because of decay, and nothing's put in its place. So as teeth move and shift, it can cause some bone loss. Clenching, grinding, bruxism. Remember, bruxism is the technical term for grinding. Again, as our teeth are moving in the socket, it's creating friction, which can lead to bone loss and gum recession. There's also defects in restorations or crowns, bridges, things like that. If they're not done properly, or if they fail, or just over time if they're not maintained, then that can lead to bone loss and tissue recession as well. Again, mobility is going to be another factor in any occlusal interference. Sometimes the dentist will check a patient's occlusion to make sure that they're hitting, on all of their teeth appropriately and not hitting higher on one tooth, because if you do hit higher on one tooth, again, just that friction of you constantly banging on that tooth can also lead to some bone loss and tissue recession as well. So that's why they're wanting to check pocket depths. And again, as the dental assistant, your role is going to be recording this information. And same thing for those of you that have taken prevention and nutrition, This chart here should look very familiar to you. For those of you who have not yet taken prevention and nutrition, this is a really good preview of what to expect. And you can talk with those that have had prevention and nutrition and know that this perio charting is not easy. They tend to go fairly quickly as you're calling out these numbers. So making sure that you're paying attention, that you're trying to stay with them as they're calling out these various numbers. And it can be a little tricky sometimes, but as you get more practice doing it, it's going to become a lot easier and better. And especially if you're working in a periodontal practice, this is something you're going to be doing all the time. So you're going to get very good at doing this. But we are recording the pocket depths. And just like, with our mobility, it's going to be anything from a 1 to a 3 would be considered normal. Anything over a 3 would be considered bone loss to some extent. And you can see that the numbers, usually if it's a 2 or a 1, it's not highlighted red. Usually anything red is starting to get on the bad side. Again, they kind of, green is good. Yellow is, kind of in between, and then red is not good. And you can see that there are some teeth that have 3s, there's some that have more, there's 4s. This one here that had a mobility of 3 has on the middle portion of the tooth on the buccal, has a pocket depth of 5, which we know that's, pretty extensive bone loss going on in that specific area of the tooth. Aside from pocket depths, mobility, they're also going to be checking for bleeding index, and bleeding index is going to be scored as well, depending on what's going on with the bleeding. There's as they're probing and getting up underneath that gum tissue in that sulcus area along the free gingiva marginal gingiva. They're able to, because you're sticking something sharp down in there, normal tissue does not bleed, unhealthy tissue will bleed. And again, they're going to call that out to you and say there's bleeding on the distal buccal of tooth number 5, and that's going to be marked as shown here in this red circle. So all of the red circles that are marked indicates that those are areas where bleeding occurred as they were probing all of these different teeth. And you can see why, because on some of these areas, there's pocket depths of 5, there's some 4s going on. Even in some of the areas where there's 3s, there is still some bleeding going on. Also recording any separation or exudate or pus, and that is shown here by the yellow circle that you see. So upon probing in this area here where there's a pocket depth of 5, there was also some pus that had come out as well to probably indicate that there's some sort of infection going on there. So all of this is something you're going to be doing as the perio assistant, and even in a general practice as well, maybe not to this extent, but definitely identifying pocket depths and helping to record those is something that you're definitely going to be a part of. And what's nice about our software system is we can actually use this as a tool to help educate our patients, to let them know that, hey, Mr. Abbott, on, this tooth here, there was some bleeding going on. So we want to make sure that you really focus on that area when you're flossing, when you're brushing, to ensure that next time you come in, we're not seeing that same issue going on. So we can use this as a nice visual for our patients to actually see what's going on. And we can also do comparisons. We can also either do it like in a graph form or kind of a list form like this. And this just helps to let the patient know what their progress is, how they're doing at home. And, we can say that, okay, Mr. Abbott, on this day, we had pocket depths of this. It looks like now that you came back, there's been some, vast improvements in those areas. What you're doing at home is really working, so you need to keep it up. Or Mr. Abbott, we noticed that on this tooth right here, on this area, you know, it was a pocket depth of 4 back in 04. 4 years later, when you came back in, it's now a 5. So we need to make sure that you're really focusing a little bit more as you're brushing and flossing on this particular area or this particular tooth. So again, it's a nice incentive to let patients know that, wow, you know, I'm really doing a good job. I need to keep it up. Or, oh gosh, you know, I really need to step up my routine at home, because, you know, they clearly see that even though I'm telling them I'm flossing every day, I really am not. So this is why I need to make sure that I'm doing it. So again, we can even print this out for our patients to take with them, and they're able to, you know, talk with family members and say, oh, look at how great I'm doing. You know, there's, you know, vast improvements in my oral hygiene, or, you know, kind of like, okay, I need to work a little bit harder at this. So perio exam, very, very important, and your role as a dental assistant in the perio exam is equally as important in documenting and recording all of this information. X-rays. X-rays are very important, as we know, because they help us to identify things that we are not able to see just by looking at the mouth. We need to be able to see what's going on underneath the gum tissue, and X-rays are a good way for us to be able to do that. And traditional way or common way of taking X-rays, especially for any kind of a hygiene exam, is usually going to be bite wings. It's also included in our new patient exam when we do a full mouth series. Bite wings are also included, and they're typically done in a horizontal fashion. And that's going to be okay and ideal for most patients. If we're dealing with a perio patient, that's when we're going to have to switch over to doing a vertical bite wing, because that way we can capture more of what's going on. You can see that the difference between the horizontal and the vertical bite wing is, even though we're seeing parts of the roots of the maxillary and mandibular teeth, we're almost seeing pretty much almost to the apex on the vertical bite wing. So it's allowing us to see a little bit more than we can here. Now for this patient, a vertical bite wing or a horizontal bite wing is perfect, because we can clearly see bone levels, some slight bone loss going on, but you know, nothing too bad. We're still able to identify that here on this horizontal bite wing. But on this patient here, if we were to get my pen here, if we were to have taken just a horizontal bite wing on this patient, we were probably only going to be able to see roughly that much of the tooth. So we can clearly see from this horizontal bite wing that we had taken, had we taken it horizontally, that there is definitely some bone loss, because all we would be able to see is what's within the red. And we can clearly see that there's no bone in that area. That's why the vertical bite wing is much better with perio patients, because it allows us to be able to determine how much bone has truly been lost. So again, depending on the type of patient that you're seeing, if you're dealing with periodontal patients that have perio disease going on, vertical bite wings are going to be ideal, so that we can actually see the level of bone that they've lost as a result of their disease. So on this one here, we can see that bone level should actually be right above here, and there's significant bone loss. You can see that along the canine here, it's pretty steady. As we start to get to the second premolar here, it starts to dip down, and as we get further back into the molar area, it starts to recede a little bit more and start to kind of go down a little bit more here. Same thing up here on the maxillary. It should be roughly about right up here. So significant bone loss, especially on this tooth right here. We're able to actually see, as you go along here, that it's same thing, kind of jagged, kind of, not consistent. And this tooth right here is definitely going to be on your 3 mobility chart here, because it's really going to be mobile because there's not much holding that in. Down here, which is another part of the exam that they're going to be looking at aside from the pocket readings and mobility, is also looking at furcation. Is there any kind of furcation going on? And remember, furcation is going to only occur on teeth that are multi-rooted. So on our mandibular teeth and the molars, because they're 2 roots, that would be considered a tooth that has a furcation. On the upper maxillary molars, those teeth have 3 roots, so those are again going to have a furcation to them. And anytime we can actually see through to the furcation, or see through with the furcation, that's never a good sign. It's an indication of bone loss, and we could clearly even get an instrument in there, which would go to the other side. So this is not a healthy tooth, and this tooth right here would also be a mobility of about a 2 or 3 as well, because not much holding it in. Unfortunately, this tooth, possibly these 2 teeth, if not all 3 of these, canine first premolar, second premolar, may have to be extracted as a result of this patient's severe and extreme bone loss that's going on here. So when it comes to x-rays, depending on the types of patients that you're dealing with in periodontal offices, because you're dealing primarily with perio patients, vertical bite wings are going to be ideal. So early signs of periodontal disease, what we need to make sure that we are looking at, you can clearly see the before and after of this patient. A lot of calculus going on. Remember, calculus is hardened plaque. This is something that cannot be removed by brushing your teeth or flossing. It has to be removed by a person, a hygienist or a dentist, with very sharp instruments and a cavitron in order to remove all of this hardened calculus on here. Know that plaque is the soft stuff that we can actually brush off with our, when we're brushing and flossing. Calculus we cannot. You can see that, all along here, along the gum line, this is all, bacteria. Plaque, calculus has a lot of bacteria in it, which can be very dangerous because it can cause infection. We can see that there's the gum tissue is very puffy. It's in this area, it's very red and irritated and very, very swollen. So this is an indication of an infection going on in this area. And upper teeth, not as bad as the lower. But this is why it's important that we take care of our patients, because we want them to go from here to here. We want them to be healthy. So some of the early signs of periodontal disease to watch out for, and I want you to make sure that you have an understanding of the difference between a sign and a symptom. A sign is something that we can see. We as the dental assistant, hygienist, dentist can actually see various signs of what's going on. A symptom is usually a result of the sign. It's something that the patient is feeling or experiencing. We aren't, because it's not on us. We can only look at the signs, and the patient could tell us what their symptoms are. So some of the signs to look for are changes in the color of the gingiva, the shape of it, the size, the texture. Clearly, here, the size, the shape, the texture of it is not healthy. The color, it's very red. It looks very irritated. So this would be an early sign of, or indication of periodontal disease beginning. Next would be inflammation, as we have going on in this area right here. We know that inflammation is the body's natural response to an infection. It sends, our things to kind of combat that infection and try to help clear it up, which our body's response is for it to become inflamed. as a result of it trying to heal. And we can probably even maybe push on this area here, and some pus or exudate might even come out of that area. So bleeding, definitely. If we were to try to floss this patient in the condition that they are in the before picture, assuming we could even get floss in between the teeth to the gum tissue, then their tissue is really going to be bleeding. As the hygienist or the dentist is removing all of this calculus supragingivally above and subgingivally below, there's going to be a lot of bleeding going on with this patient as a result of this bacteria and all of this calculus that's on there. So definitely bleeding is a sign. Talked about exudate. Again, if we push on this area, you might get some pus coming out. And development of periodontal pockets. So this patient may be at a 4, possibly a 5 in certain areas, just depending. And again, that's going to be determined by using a special instrument that the dentist or the hygienist will be using to identify what those pocket depths are. Remember, anything 3 or below is considered normal. Anything above a 3 would be considered bone loss, and depending on the higher the number, the more bone loss there is. Common risk factors when it comes to periodontal disease. I really like this picture because you're able to get a good understanding, not just looking at it physically, the changes, but also with the graphic, with the cartoon picture here on the side. It kind of shows you what those stages are. Healthy tissue is pinkish. Bone level is where it needs to be. We have that nice embrasure in our interdental papilla right here. This is healthy tissue. As we start getting into gingivitis, we start to get some irritation, some redness, possibly some swelling, a little bit of bleeding. We can begin to see that we don't have that nice interdental papilla like we had up in the healthy tissue. So we've started to already recede some of our gum tissue as a result of the gingivitis. As we get into the moderate periodontitis, we can see that very irritated red. The tissue has receded tremendously. The bone is starting to recede as well in certain areas where it's probably a little worse than others. And definitely when we get to the severe periodontitis, that bone level has really receded, gum tissue has receded, so again you don't have that nice interdental papilla up in this area like you did when it was healthy. So you can clearly see by these graphics the significant changes that periodontal disease can have and the impact that it has on not just the teeth but also the surrounding tissue. Which is what periodontics is dealing with. Periodontics is dealing with the tissue, the diagnosis, the treatment, the prevention of the supporting tissue to include the bone. And this is what we're trying to avoid in a lot of our patients, is trying to catch it here in this stage or even in this stage and try to maintain them where they're at to ensure it doesn't get any worse. It won't get any better, but we're trying to make sure it doesn't get any worse, because once we get to this point, a lot of times we're removing teeth because, I mean, you can clearly see from this visual here, there is not much holding in these 4 anterior teeth. So more than likely, this patient is going to end up losing these teeth as a result of their periodontitis. So what are some common risk factors for this? It's going to be smoking. We know that certain habits do play a significant role in the health of not only our bodies, but also our gum tissue and our teeth. We have certain medical conditions like diabetes that can definitely wreak havoc on a person's mouth as well as their body. And it's not just the diabetes or the condition itself, it's also the medications that they're taking as a result of their condition. Poor oral hygiene. We know that if you don't brush and floss your teeth, this is what's going to happen. You're more than likely going to end up losing a lot of your teeth eventually, just because that bacteria is allowed to stay on your teeth. It's going to not only decay your teeth, but it's also going to recede your gum tissue and also your bone. And sometimes patients that have some habits, whether it's drug use, smoking, alcohol abuse, they're not really thinking about their oral hygiene. So that kind of goes out the window, which can greatly affect people with certain types of medical conditions. Could lead to maybe dexterity issues where they're not able to properly brush their teeth or floss their teeth appropriately. So that can lead to poor oral hygiene. Osteoporosis. We know that osteoporosis is a medical condition that causes weakening of the bone, deterioration of the bone, and the bone in our mouth is also going to be affected by that. And again, medications that they might be taking to sort of help with osteoporosis can also do some damage to the bone and the gum tissue as well. And then stress. We know that stress has a lot of effects on our body. It also has effects on our mouth. It usually begins with gingivitis. You might notice that, times or periods in your life where you might be under a little bit more stress. You might notice that your gum tissue might be a little bit more red. It might be a little bit more irritated. It might bleed a little bit more when you floss your teeth or brush your teeth. That can be an indication of stress, especially now with what we're going through with the COVID-19 pandemic and, the uncertainty of our economic future. Maybe you lost your job, things changing with school. Maybe you're having to not only do school yourself, but also maybe be a teacher to a child as well. So trying to make sure that you're staying on top of what you need to, but also helping your child can lead to some very stressful times. So just know that, if you start to see that, changes to your gum tissue or your oral or your hygiene or your mouth or gum tissue, you might want to take a look at, what's going on in your life, because it could be due to maybe some stress. Also medications, talked a lot about that. And HIV, AIDS, anybody with any kind of an immunocompromised immune system, especially a person with HIV or AIDS, they're going to be more prone to getting a lot more diseases on top of what they have. And periodontal disease is no exception to that when it comes to a person with immunocompromised immune systems. And then local factors, we kind of talked about this a little bit before. Any kind of dental work or appliances, faulty dental work, maybe, it's neglect on the patient's part, or, appliances like a partial that's allowed to sit on the gum tissue. That can cause some damage to not only the bone, but also the tissue as well. We know that periodontal disease can cause a lot in different types of issues medically. There's been a direct link between periodontal disease and heart disease. There's been a direct correlation between periodontal disease and pregnancy complications, usually resulting in the premature babies or low birth weight babies, which is why it's extremely important that we are making sure that our pregnant patients are coming in regularly for their cleanings, making sure that we are monitoring them, because we want to make sure that their oral health, especially when they're pregnant, is going to be where it needs to be. And the reason this occurs is because we know that there's bacteria in whether it's decay or whether it's in the calculus, the plaque, there's bacteria that's in there. If it gets into our bloodstream, it's going to circulate throughout the entire body, and it's going to have an effect on various types of organs. It can lead to diabetes, can increase diabetes risk, respiratory diseases, artificial joints. We know that anybody that has a knee replacement or a hip replacement usually needs to be pre-medicated, and that's going to depend on their orthopedic surgeon as to whether they need to be pre-medicated or not and for how long. Some say it's indefinitely, and some say after a certain period of time from that joint replacement, then they're good. But always check with the patient's orthopedic surgeon when it comes to pre-medication. But the whole purpose of a pre-medication or an antibiotic prior to any kind of dental work, especially cleanings, is to prevent that bacteria from traveling in the blood system, going to that area where the artificial joint is and causing a failure as a result of that bacteria getting in there. There's also been some recent studies that have been done with periodontal disease and neurological diseases such as Parkinson's and Alzheimer's. And again, that bacteria can also lead to other things, including cancer. So very important that you have an understanding of what periodontal disease is, and how we need to make sure that we're talking with our patients and educating them on the importance of having good oral hygiene. So with this, you're able to answer your questions in your activity.